If you have a bunion like this, then sooner or later, the question will arise more than likely, do I need surgery on that bunion? And that's what we're going to answer in this video. Hey guys, my name's Andrew Wine. I'm a foot and ankle physiotherapist here at Freestyle Feet, where we try and help you solve all your own foot and ankle issues. In this video today, we're going to be running through the 3 considerations for whether you need surgery for a bunion or not. This is what I go through with my patients here in our practice here in Melbourne, Australia. And at the end, I'm going to show you a bonus tip that irrespective of whether you decide that you probably do need surgery or don't, you can get started on straight away with this bonus tip. So make sure you watch through to the end. Okay, so let's get into our 3 considerations. And I've put these in order because I really feel like they are most important to the least important. I'll explain to you why. The first tip is alignment. So really the consideration for whether you need surgery or not should be around the angle that you have at your great toe joint. Now a bunion is when this alignment starts to pull the toe across, and there's 2 different angles to consider. One is the intermetatarsal angle here, which is quite difficult to measure accurately in the clinic. We typically do that on x-rays. But what you can do is measure the alignment of the HAV angle here, which is when the toe goes across. And I've got a video, and I'll link to it below in the description as to how to measure that yourself at home using a protractor. So the key number for us here at the clinic is 45 degrees. Bunions are categorized into mild, moderate, and severe deformity. And generally this angle is considered normal if it's around about 15 degrees or less. Some of the papers talk about 20 degrees, but here at the clinic, we talk about 15 or less being normal. And once you go past that, you start going through those grades, mild, moderate to severe. 45 degrees is generally accepted to be the severe category. Now, I have seen people, one of the podiatrists and chiropractors that I've had some training with, he has claimed that he has brought a 60-degree bunion back. I personally haven't seen this in the clinic, so we typically go via 45 degrees as our cutoff. So if you measure that angle here at the first MTP joint and it's over 45 degrees, I really think you are probably a candidate for surgery. Now, many of you might have seen some of my other videos where I talk about non-surgical methods. I think it's really important that you know I'm not against surgery at all. In fact, I work with a lot of bunion surgeons here, foot and ankle orthopedic surgeons. I've written up a lot of their protocols here in Melbourne for them, and we see a lot of post-operative patients as well. So I'm certainly not anti-surgery. We just strongly believe in our clinic and also at Freestyle Feet that we want to do everything we can to avoid surgery in the first place. So there's the first consideration. You really need to measure that angle and see where you sit. Now, what if you are under 45 degrees? Then in that case, you really want to try some of the non-operative methods. And I know some of you might think that these are controversial, but there actually is good evidence, and this is what we do here at the clinic, for using things like orthotics, splints, night splints, toe spacers. We're a huge fan of toe spacers, and we try that with all our patients if we're trying to avoid surgery. Strengthening the muscles around not just the toe, but the whole foot, and even up around the hip has evidence around it as well. And a combination of exercises, footwear changes, orthotics, manual therapy, so manipulating the stiff joints and getting them to move better, and then strengthening exercises. There's actually quite a bit of research that suggests that this is definitely worthwhile doing, and in some cases it may actually change the angle. And that's certainly been our experience at the clinic with our patients, is when we've implemented a treatment regime like that and the patient is motivated, we can change the angle of the bunion. Okay, consideration number 2 is function. When your function is becoming really limited, then you really also may want to consider surgery. And what do I mean by limited? If you can't exercise, if you can't wear a footwear that you want to wear, and you really can't maintain your physical activity levels, this is quite a concern, because we know that those things are important for overall health, mental and physical, and longevity. So it's really important that you can maintain your function in daily life, and not just basic levels of function, but ideally being able to exercise at a higher level as well. So that's our second and also key consideration for surgery, is when your function is being really limited. Okay, so there you have it. There are our top two. The third consideration is pain. Of course, pain is usually what prompts us to do something about an injury or a body part. And it's usually what people are presenting to the clinic with. So it might seem strange to you that pain is actually our third consideration. But here's what we know about pain now with current neuroscience, is that pain is a really complex topic that isn't necessarily associated with tissue function or dysfunction. What do I mean by that? You can have a bunion that has quite significant alignment. I've seen a bunion that has a 60-degree HAV angle, is quite deformed and crossing over the second toe. I've seen plenty of patients with this degree of deformity with zero pain. And so they certainly don't want to have an operation. They think it's unnecessary because they don't have any pain. And then of course we've had patients come through the clinic that have only got a mild hallux valgus angle, say, let's say 20 degrees. So they're still able to fit into most footwear, yet they've got quite extreme pain, say 9 or 10 out of 10 at times on a VAS scale. So pain is certainly a consideration, but it shouldn't be the only consideration, which is why we've got it down at number 3. So what do we do in the clinic to really treat the pain? Well, there's a couple of things we do. We certainly do everything we can to improve alignment, improve muscle function, and take pressure off tissues, because we know that the mechanoreceptors inside the joint and around it will send less signals up to the brain to process. We'll do all those things anyway, and often that does decrease the pain. The other thing we'll do in the clinic is educate the patient on what actual pain is, and the first thing that they're usually stunned about is that pain is an output of the brain. Traditionally, we thought that pain starts in a tissue source, so it comes from your big toe, for example, up into your brain, and it registers or trips off a light, and that's pain. We actually now know that that's the other way around. We get inputs from the body always, but those are processed in such a complex fashion that pain is an output. So that type of education is really, really important for the patient. It has been shown to decrease pain levels just through education. We use this book, we use Explain Pain. This is the clinician version that's really complex. This is Explain Pain Supercharged, but we certainly recommend this as required reading for the majority of our chronic pain patients. So I'll put the links to this particular book below. You might find this a fantastic resource if you've had pain past a short period of time, just a few weeks or more. There you have it. There are our 3 considerations as to whether you require surgery or not. Hopefully that makes sense to you. If you're finding this content helpful, please give us a like or a thumbs up, and by all means put any questions you have in the comments and I'll do my best to answer them. It really means a lot to us if you like the content we're trying to help you with. Now, I mentioned a pro tip earlier on, and I'm going to show you that right now. Here's something that you can start today, and you should start today, irrespective of whether you think you may need surgery or not. And this exercise is using a strength band. This is our special strength band that's just got the right amount of tension into it. And if you don't have this, then you can get started with a thick rubber band. And I really want you to do this tonight, straight away, to start working on the bunion. Okay, so with your strength band, every evening we want you to get into this habit straight away tonight to start stretching the toe into ideal alignment. So if we have a look down at the feet we've got here, where they're just developing a mild bunion, with the band here, we want to stretch apart until we get a slight overcorrection. Of course, your toes might be pushed across this way. We want to pull them back in, and using the resistance of the band to stretch them apart, keep everything else relaxed. And I want you to do this for 2 or 3 minutes if you can handle it. You will feel a stretch through here as we start to stretch these tissues that have become contracted, and that will help start stretching the soft tissues whether you are going to have surgery or not. So there you have it, guys. There are our 3 considerations for surgery or not. If you do need surgery and you want any other help or advice, please just send us an email or pop it in the comments below and I'll do my best to respond to it. Of course, if you want to try and avoid surgery, then that's exactly why we created the Banish Bunion course. I'll also put the link to that below. It was a course designed for health professionals that we've made available to the public to really try and help people on their own, in their own home, follow along with everything we do at the clinic to try and prevent surgery, which, as you know, that's our focus here at the clinic, is to try and avoid it. Okay, there you have it. I hope you got a lot of content value out of that. And please, if you do like it, subscribe to the channel and I'll keep producing content like this for you and your feet. We'll see you in the next one.